Of course, we're monitoring our numbers closely and monitoring the impact of the restrictions that were put in place just about 10 days ago. We know that the impact of restrictions does take about 1 to 2 weeks to start to be seen. And so we should be seeing the impact of the mandatory restrictions in Edmonton and Calgary and the new voluntary restrictions in Calgary by mid to late this week, which will help us understand if additional restrictions are needed. It's about 40%, and that is concerning, where we don't know where the virus has come from. But we do know what the trends are in our own data, and those trends match the transmission issues that we're seeing in other provinces, which are social gatherings. They are times when people are spending time together in close contact, not wearing masks, not using distancing. The issues happen when individuals perhaps are not staying home when they're symptomatic, and those are the things that we're really focusing on. Of course, we are concerned about that proportion that we don't know where they're coming from. However, we have seen a slight plateau, as I mentioned yesterday, in our case numbers, and we will be watching very closely over the coming days to determine if we have been able to start turning a corner with our current restrictions or if more restrictions are necessary. It's important to know the triple layer recommendation is specifically for cloth masks, so those non-medical masks, and we have been looking at the masks that were distributed to schools in particular. The vast majority of those that were distributed to school are 3-layer cloth masks. And so we are in conversation about the small number that were the 2-layer and how to manage those. But it is important to understand that with cloth masks, the non-medical masks, additional layers do increase the protection. And so while 3 layers of cloth are now recommended, it's important to remember that it's not a binary. It's not zero protection and full protection. Additional layers add additional protection. And again, the current evidence would indicate that those 3 layers are important. However, I would encourage people, if they haven't yet had time to get a 3-layer mask, to continue wearing the 2-layer while they get the 3-layer. Many of the 2-layer masks actually have a pocket for filters, and so it's fairly easy to put filters in place with that additional layer of cloth or to purchase the disposable filters that are available.